Hi everyone, welcome to Nursing the Livingston Way. My name is Susan Livingston. I'm happy to be here with you today, and let's see what we're going to talk about. Oh, show me what you know, insulin questions. Okay, this would be really good for those getting ready to take NCLEX, or it's good for a veteran nurse just wanting to make sure she stays up on her knowledge on different insulins. So it'd be advisable that if you are not knowledgeable on insulins, that you watch my video called Different Insulins. It takes 20-25 minutes to get through it, but it's pretty jam-packed with information that you need. Or if you're just well versed in insulins, just jump right in. Okay, so let's go. This we're not going to go over today. This was on my Different Insulins video. But there are obviously different insulins, and what you really, it's crucial that you need to know as a nurse is when the insulin has its onset of action, which means when it starts to lower blood sugar, the peak action when it really drops the blood sugar, and the duration of action, how long it drops the blood sugar. It would be very important because when an insulin is peaking, that's when the client is at greatest risk for hypoglycemia. Okay. And like I said, we're not going to go over this, but this was what we went over in the last video. Okay, so here we go. Here's how this is going to work. I'll read this question out loud. I'll put all the answers up there. You push pause on your device. You try to answer it. Then I'll pop in, and then I'll help you answer it. Okay, let's go. Nurse administers 6 units of insulin aspart at 0800. At 8:15, the breakfast tray has not arrived. What should the nurse do? All right, here are your answers. Push pause, see if you can figure it out. Okay, well, the answer is number 2. Check that blood sugar and administer 15 grams of quick-acting carbohydrates, something sweet, like 4 ounces of orange juice that has its own sugar in it, and that will get that sugar up. The reason being, insulin aspart is a rapid-acting insulin. It has its onset of action within 15 minutes after you give that shot, and in fact, it is a rule that if you're giving insulin aspart, insulin glucosine, or insulin lispro, that you have that food tray right in front of the patient. Do not give the shot without making sure the food is there. That is a requirement, okay? So the nurse messed up here because really, she shouldn't have given that insulin yet until the breakfast tray was there. But what did she do? Well, now she gave the insulin. Breakfast is going to be delayed. Now she's created more work for herself and more danger for a patient because the sugar is going to start to drop. Now she's got to check the blood sugar and try to get his sugar up or prevent it from dropping rapidly. So anyway, let's go. At 07:30, a nurse administers 20 units of isophane insulin suspension to a client. The nurse should identify that the client is at increased risk of hypoglycemia during which time frame. Here come your answers, and push pause and see if you can answer it. Okay, the answer is number 3, 11:30 in the morning to 17:30 at night. And the reason being is that is the time frame that this intermediate acting insulin peaks. It peaks in like 4 to 12 hours after you give the shot. So that's when they're at greatest risk of hypoglycemia. And a nurse really needs to understand that, because if you gave, say, too much insulin, or they didn't eat much, or they've been very active or something like that, they can start showing symptoms of low blood sugar during that time. It would be up to you to be able to spot that, the low sugar, and know when that could happen. Okay, so let's go. A client's blood glucose level is 320. Woo, that's up. The nurse notifies the provider of this result and expects a prescription to administer which insulin that will begin lowering the blood glucose within 15 to 30 minutes. So if you have a high sugar, we want to get it down, and we want to do it pretty quickly. We don't want to do it over time. That's high. We need to get it down. So there's many answers here. I'll put all of them up here. You push pause, see if you can answer it. Okay, the answers are insulin aspart. That'll start to lower it within 15 minutes. Yay. Insulin lispro will start to lower it within 15 minutes. And regular insulin will start to lower it within 30 minutes after you give it. So that blood sugar is going to start to come down. Isophane insulin suspension and regular insulin 70/30, that's an intermediate acting insulin. That won't kick in until 2-3 hours after you give it. Insulin detamir and insulin glargine are long-acting insulins, and they don't peak at all, and they have a 2-hour onset, and we want to get that sugar down now. Okay, let's go. A client receives regular insulin intravenously. And if you remember, regular insulin is the only one that can be given through an IV. And it's scheduled to be discontinued at 10 o'clock in the morning. The client needs to be switched to a subcutaneous injection of isophane insulin suspension (NPH) to allow for continuous insulin coverage. What time would the nurse administer the subcutaneous insulin? So we don't miss any point in time where he's not covered with his insulin. Okay, so here comes your answers. The answer is 7 o'clock in the morning, 8 o'clock in the morning. I can give that injection of NPH. And the reason is because this isophane insulin has an onset of action 2 to 3 hours, 2 to 4 hours, something like that, around that. It's not real fast after you give it as an injection. So if we're going to shut the insulin off IV at 10 o'clock, and that's going to start getting out of his system like immediately, I have already got to have this intermediate acting insulin in him. So plan it. That's cutting off at 10 o'clock. Back it up 2 hours. 10, 9, 8, we can give it. Or back it up again to 7. That way, when it starts to have its onset of action, it's time to turn that off. And he won't miss any insulin coverage. Okay, let's go. A nurse prepares to administer 8 units of insulin glulicine at 12 o'clock. Okay. The dietary department calls the nursing unit and advises that the lunch tray will be delayed 45 minutes. Which action is required of the nurse? Okay, that's a rapid acting insulin. It's going to start dropping in 15 minutes. So let's see what your answers are. Okay, the answer is number 3. Just simply, it says you're preparing to give it. You haven't given it yet. Great, because you do not give that insulin without the food there. Okay? Insulin glulicine, insulin aspart, insulin lispro have to have the food in front of the patient. Period. End of story. Always and forever. Amen. Now, the thing is, you haven't given it yet, and food is going to be delayed 45 minutes. Well, then delay the shot. Wait for the food to get up there, and then give the insulin. Okay? All right, next. The nurse prepares to administer 10 units of regular insulin and 20 units of isophane insulin suspension (NPH). So 2 different insulins. One of them is works kind of quick, and the other one works over time. And we're going to give it subcutaneously at 7:30 in the morning. The client's breakfast is not scheduled to arrive until 8 o'clock. Okay, which action should the nurse take? Well, none of these are going to drop it real fast. None of them are rapid acting. The regular insulin is short acting, and it's going to start to work within 30 minutes. So you're going to give that injection at 7:30, and food's not coming until 8. Well, that's fine. Here's your answers. See if you can figure it out. Okay, what are we going to do? Number one, go ahead and administer the insulins. Yeah, because none of them are rapid acting. And you don't have to have, for either of these, you don't have to have the food right in front of them. With the regular insulin, they probably need to eat within 30 minutes, and food will be there within 30 minutes. So no harm, no foul. That's how you do that. Okay, let's go. A nurse should know that which insulin would be needed to be rolled between the palms of the hands before withdrawing it from the vial. Okay, not all insulin needs to be rolled, only certain ones. So let's see. Okay. Number 5, isophane insulin suspension. A nurse should know that anytime a medicine says it's a suspension, it means it's there's 2 or more things in that container. Now, if it was oral medicine that said suspension, you shake that. That's okay. But if it's in a vial for an injection, you don't shake, you roll it to mix the ingredients together. Don't shake that insulin vial because it's going to have too many air bubbles in that vial and you're going to be dealing with a lot of air in the syringe. Roll it and mix them. Okay? All right. Now, a nurse must know the different insulins. You have to know the different insulins. A patient, this can kill people. And you have to understand and you have to know and you have to be able to spot problems. And you've got to be able to know what to do to stay safe and protect your license, protect your patient. If you don't know what you're doing, the client is harmed because of you, because of your lack of knowledge. And I'm not an attorney, but they can't, if they were harmed because you didn't know what you were doing, whether you meant to harm them or not, they can sue you. And that's called, if you think back into the beginning intro to nursing, when a nurse hurts somebody and it was unintentional, that's called an unintentional tort. And that, you better be getting an attorney if they were actually hurt, like killed or something to that effect. And they can sue you for negligence or malpractice. And I would hate for this to be you and that be the prosecuting attorney having a heyday on your butt because you didn't know what you were doing when you were given the insulins. Okay, that's not going to be fun. And I'd like to ask you, what are you going to say? What are you going to say? Well, I just didn't know. You can't say that as a nurse. If you don't know, we don't know everything. But what we have to do is on things that we don't know, we look them up and we figure it out before we do it. That's what a reasonable and prudent nurse does. And that's what I would expect you to do too. Okay, so that's test your knowledge on the insulin questions. And I'd like to thank you for being here. Don't forget, please, 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 pretty please, hit subscribe. It should be a little white and red button in the bottom of the screen. Hit subscribe, leave some comments, watch these videos. I want this to be my new classroom. And I would like to work with students and nurses across the country instead of just in a little classroom in a little school. I would like to branch out. So thank you very much, and I'll see you next time.